Hello everyone. We have seen the devastating effect of second wave of COVID-19 in our country. So many people have lost their life and still so many are struggling in the hospital for their survival. In the mid of this pandemic, there is another new concern or threat which has risen is the number of cases of mucormycosis or what we call black fungus. The cases has increased drastically in the past few days, and that it has been declared as a notifiable disease under the Epidemic Act, and so far many states has declared epidemic of black fungus in their state. If we talk about the Delhi, there are around 197 cases which has been reported till now. And so the question is black fungus or mucormycosis a new disease? No, it is not a new disease. This fungus is present since ages, and it can commonly be seen in the house, on rotten vegetables, rotten fruits, rotten food. It is present in the soil, and the spores are constantly every time present in the air. So what is it that is protecting us from this fungus, that we are not getting infection by black fungus or mucormycosis? It is our immune system, that we have the power of resistance, that we are fighting back to invasion of this fungus in our body. So something has changed in this pandemic, or what has made this surge in the number of cases of the black fungus or mucormycosis? The answer is very obvious, and we all know that our immune system is down. The weaker immune system that has made the suitable environment for this fungus to infect the human body. So there are many conditions which can lower down the immune system. Some of them are like uh, prolonged hospitalization, which can be either due to the any chronic illness or might be due to the COVID-19. The patients are admitted in the ICU, so these patients usually have their weak immune system, so they are very susceptible. Secondly, the person who are having diabetes, and they have the uncontrolled blood sugar level, and sugar make the perfect culture media for these fungus, and make environment very adaptable for the fungus. Then there are the patient who have cancer and they are on chemotherapy. Then a person who have received organ transplantation, and a severe burn patient. So these category of the people usually have the weaker immune system, and these are susceptible to get the mucormycosis or black fungus infection. So the next question which should come into our mind: how to detect or how to know that the person is suffering from, or he might be suffering from, the black fungus or mucormycosis? The first thing we should know that the person is either person is having a weaker immune system, some chronic illness is there, and there are certain sinus symptoms. We talk about sinus symptoms, like I have divided them into the parts or organs, like from the face only. Like the usual route of the fungus to enter in our body is nose. So in nose, if we talk about the sinus symptoms, that the person can have a nasal obstruction, or he can have persistent headache which is not relieving even on the medication. Then coming to the eyes, the person can have a swelling, redness of the eyes, the dropping of the eyelids, and in severe cases the person might lose the vision, and he can have a diplopia also, and blurring of the vision. If we talk about the face, the person can have a swelling over the face, and there is a loss of sensation which has been reported. And if we talk about the mouth, in mouth there can be ulcers and the loosening of teeth, and the person might have a loose teeth, or the teeth has fallen. So these can be the silent symptoms on the basis of which we can suspect the infection of the mucormycosis. And there another thing, that the blackening and discoloration of the skin also reported. Beside this, what is now, once we are thinking that the person is suspect case of mucormycosis, what should be done? He should be at once admitted to the hospital, because these patients usually require hospitalization. The treatment is hospital based, and it can be medical treatment in the form of tablets or drugs, IV drugs, or it can be a surgical. In medical treatment, the drug of choice is amphotericin B, and or posaconazole can be given. And in surgical debridement is usually done to clean the necrose part, because what this fungus do, when it germinates, it releases the mycotoxin, which form the microthrombi in the blood vessels. As a result, the blood supply of that particular tissue is interrupted, and that particular tissue is necrosed, जिसको हम सड़ना भी बोलते हैं, गल जाता है वो. And because of that necrosis, the surrounding tissues are also affected. So surgical debridement is needed in those cases. And most importantly, prognosis. So the risk of mortality is 50%, and if the person is not treated on time, the risk of mortality can go up to 80 to 85%. So this is a kind of very fatal infection. And certain points regarding mucormycosis are like it is non-contagious. There are no human-to-human transmission reported. Secondly, the infection of mucormycosis can happen during COVID infection and after COVID infection also. So another thing which is very important is how to prevent ourselves from getting this infection. So there is a one proverb, eye sees what the mind knows, and here it applies to the social awareness. That if the society is aware of the signs and symptoms of this disease and what are the people who are the risk, then the disease can be diagnosed early and the treatment can be given early and the life of the person can be saved. Secondly, we are listening cases mostly from the hospital, so it is a kind of hospital-based infection also. So in hospital, what can be done? The air sampling of air in the ICUs and what can be done so that the concentration of the spores can be known. Thirdly, the humidifier which are used for the oxygen therapy or the masks which are used to deliver the oxygen should be sterile. And at the level of individual who are suffering from who are recovering from the COVID illness or any chronic illness, they should not be allowed to go home. They should be advised to go home, and the proper sanitation and proper hygiene should be maintained, because this fungus usually grow on the rotten vegetable, rotten fruits, or in rotten things. So those things should not be kept in the house. And lastly, we have to follow the COVID appropriate wear, like mask. We have to wear the mask, because when we wear mask, the chances of inhaling the spores are decreased and we are usually protected. So this is all about the mucormycosis. I hope you find it helpful and informative. If you like it, you can share, or if you have more queries, you want to know something more, you can drop your questions in the comment box. I will be happy to answer them. Thank you.